Hi, I'm Sunir Garg with the Wills Eye Retina Service, and I'm standing here in front of the Wills Eye booth at the American Academy of Ophthalmology annual meeting. There's been a lot of great things that have come out of this meeting. Two different topics stand out to me. On Friday at the Retina Subspecialty Day, the DRCR-NET Protocol S data came out, and this was a randomized trial comparing patients with proliferative retinopathy, some of whom got pan-retinal laser photocoagulation, which has been our standard of care for 40 years, to intravitreal injections of anti-VEGF agents. And much, I guess to some degree, not to my surprise, but the anti-VEGF agents were found to be very effective in preventing complications of proliferative retinopathy. But what was more impressive is the fact that people who received anti-VEGF injections actually had better visual acuity outcomes, as well as better preservation of visual field compared to people who got pan-retinal laser. So the question now becomes, well, do we take our standard of care for 40 years and basically retire it in favor of the new data? Or how do we balance out the new information that we have with our standard treatments? So a lot more work is left to be done in that area, but it's very thought-provoking and very exciting. The second thing that came out was the Edward Jackson Memorial Lecture yesterday by Dr. Ann Coleman out of Jules Stein Eye Institute. And she presented her work using the IRIS registry and looking at the rates of endophthalmitis and comparing that with the rates found in a Medicare database. And what she found was that the IRIS registry was able to provide very robust data that in many ways mirrored some of the findings in the Medicare database. But for ophthalmology, it'll be not only a tool to help us improve our quality of care to patients, but also be able to hopefully help individual doctors benchmark themselves against their peers and hopefully continue to improve their own practice, allowing us to better provide care for our patients. Thank you very much.